My name's Howard Catton. I'm a nurse and the Chief Executive Officer of the International Council of Nurses. Life course immunisation is hugely important for ICN and for nurses because clearly it sustains health, but it also prevents disease. It's the best public health buy we have, and through nurses who overwhelmingly are the people who administer a vaccination, it provides an opportunity for somebody to talk to a healthcare professional who they trust, about a whole pile of other issues that are related to their health as well. Maybe concerns about their physical health and well-being, it may be their mental health, it may be social issues, but all of which can impact on their health. So some people see vaccination as a jab in the arm. For nurses, it's so much more than that because it provides the opportunity for this much wider and engaging health discussion with the patient. ICN contributes to promotion of vaccinations through a number of ways, through our advocacy and through our communications. In our policy documents, in our education statements, we clearly set out the evidence-based case for vaccinations. We have a major congress coming up this year, and vaccination and nurse experts in vaccination feature right across our Congress program. We do it not just as ICN, we do it with the other health professions through the World Health Profession Alliance, with our medical, dentistry, pharmacy and therapy colleagues. We work together to promote vaccination. In our advocacy with governments, we make the point that vaccination strengthens their health system. There are many nurses who are involved in research and development and trials as well. And we are also very clear that we think being vaccinated as a healthcare professional is entirely consistent with the codes of practice, codes of ethics that nurses work to. And we advocate as well very, very strongly for the right of health workers and nurses to have access to vaccinations as well. The overwhelming impact that we want to achieve is to strengthen health systems and to improve the health and well-being of people everywhere. It's a part of universal health coverage to be able to have access to a vaccination. We know that demand for healthcare is rising right the way across the world, and that's putting great strain on our health systems. Vaccinations is a key part of the solution as to how we deliver access to healthcare that improves health and is affordable right the way around the world. But we also want to reinforce and strengthen nursing's leadership role in vaccinations. Nurses are overwhelmingly the people who will administer a vaccine, and because of that, they know how systems can best be designed to ensure maximum coverage. We have evidence that shows where nurses are involved, then the uptake of vaccinations rates improve as well. And there is a key part for nurses as well in terms of helping to address vaccine hesitancy. Nurses consistently are rated by the public as the most trusted professional, health professional. The conversation that they have with patients allows them to address fears and concerns, to share evidence in a way which is explainable and understandable with patients as well, to support patients and people generally to make their own choice, but to make an informed choice about what's best for them and their family. So nurses have a role right the way across practice, leadership, and increasing vaccine uptake by reducing hesitancy. We are deeply concerned by the impact of decisions in the US to withdraw health funding. We've spoken publicly and we've documented evidence from nurses which have seen programs which have simply had to stop as a result of these decisions. And it includes things like vaccinations, as well as other key and important public health measures as well. Nurses as well being laid off as a result of funding ceasing. We are at a moment of increased global health risk and threat. And that's a risk for all of us, because we know that with the withdrawal of the money and the impact that this is going to have, the risks of increases in infectious diseases for people right across the life course, the extra burdens that will put on our health systems, the widening of inequalities, the undermining of preparedness to address health threats and future pandemics, all are detrimentally impacted, which isn't just bad for health and future health for all of us, but also will bring great costs as well. So we hope that there is rethinking and reconsideration of how important investment from everybody is if we are to deliver the ambitions of improved global health for all. I think the key messages I'd want to share are that it is the best public health investment you can make to deliver and support uptake of vaccinations right the way across the life course. You're increasing access to healthcare, you're being hugely effective at preventing disease, and you're helping people who have chronic conditions to manage those, to be more stable, not to have peaks and troughs and require emergency admissions as well. All of these things are, of course, good for individual health. They benefit hugely public health, and they are highly cost effective. And to deliver on all of that, you need your nursing workforce. You need the people who are administering vaccinations, make sure that they're involved in leadership and design of vaccination systems, make sure that they're advising, helping, even at the forefront of public health messaging as well, because they are such a trusted professional. When you're investing in vaccinations, you're also investing in nursing to deliver great public health for everybody.